This is a right knee arthroscopy where we've identified a horizontal cleavage tear of the medial meniscus. At first look, these are not always seen. We use an arthroscopic biter and shaver to start the debridement. Since the tear is located within the mid-substance of the meniscus and not closer to the periphery, where there's adequate blood supply for healing, these injuries are often treated with a partial meniscectomy as opposed to a meniscus repair. I use a probe and insert it within the mid-substance of the tear so we know what level we need to go to remove the damaged meniscus. Then an electrocautery device is used to help congeal or seal the fibers to decrease the risk for a re-tear after debridement. Once this is performed, a probe is used to assess the integrity of the meniscus. We perform a synovectomy, inspect the ACL, so that we can enter the lateral compartment to continue the knee arthroscopy.
The heel slide seen here is an active assistive range of motion exercise utilized by the patient immediately post-op knee surgical intervention. This is to regain range of motion and to push synovial fluid in and out of the joint to help reduce swelling and inflammation, as well as lubricate the joint and provide nutrition needed to further go through physical therapy. Neuromuscular re-education is paramount immediately following knee surgery. The body shuts down the neuromuscular pathways to ensure no further damage is done following the injury area or site of surgery. Here, the patient is using a neuromuscular re-education stimulation unit to facilitate a contraction while they go through a range of motion to reestablish that brain-muscle connection. Regaining passive and active range of motion following surgical intervention is essential to ensure that the patient regains full range of motion before they start most of their strengthening exercises. It is essential for normal daily activities such as sitting, standing, walking, going up and down stairs, and other athletic activities. Here the therapist is taking the patient through a passive range of motion. When we get a patient in immediately post-op any sort of knee surgery, we go right to patella mobilization to make sure that there is proper tracking for the quadriceps during any motion or activation that needs to be done by that knee throughout the range of motion. It is essential to make sure the patella tendon and the kneecap itself remains pliable. Another basic but essential exercise in physical therapy immediately post-op knee surgery is the quadriceps set. Here we have the patient put a towel roll underneath the knee for a tactile cue for when they squeeze the quad, they push the knee down into the towel, allowing for full knee extension. One of the first exercises first utilized immediately following surgical intervention for the knee is the straight leg raise. Here the patient is doing a straight leg raise in flexion, ensuring there is no quad lag by keeping the knee locked into full extension and raising to about 45 degrees. Mostly the rectus femoris is what's activated here. This is essential for most daily activities and is the building blocks for other things in physical therapy.